Health Secretary, you say this is the worst doctor strike in NHS history. I presume carried out then, you must mean, by the worst doctors in NHS history.
Not at all. I think junior doctors do a fantastic job, and
then why don't you pay them the money they want
to do an even better job?
Well, if they do a fantastic job, why don't you recognise that?
Do I recognise what?
Why don't you recognise that they do a fantastic job? Because obviously you don't think they do a fantastic job. You think they do an all right job.
I've been on this programme, Eamon, I've said I think they do a fantastic job. And junior doctors in particular are some of the hardest working people in the NHS who work a lot of nights, a lot of weekends. But the reality is that we all of us want to make the NHS the safest, highest quality care, and that means being able to promise patients consistently high care across all 7 days of the week. And the way to solve the honest disagreement we have about how we get there is to sit round the table and talk. It is cooperation and dialogue, and not confrontation and strikes, which is going to cause absolute misery to hundreds of thousands of families up and down this country.
But you've got no cards to deal. You saw the Department of Health leaked what is termed risk register, right? It says there is a danger of a workforce overload. There is a lack of costings associated with all of this. There is limited data as to how this could work. This is from the Department of Health.
Well, Eamon, that same document actually says that we are on track to deliver 7-day services in hospitals in 20% of the hospitals in the country next April, and going on to around half the hospitals a year later. But what governments have to do is every time they have a new policy, we do what's called a risk register. We look at every single thing that could go wrong, and you would expect us to do that, and of course I would want my officials to examine every single angle of a new policy. But actually what that document says is that we are on track, and the real issue here is that there is going to be...
After all these talks, you're on track in 1 in 5 hospitals. You have no idea about funding, you have no idea about staffing, you have no idea about resources. That's what's coming out. After all this time, you're telling me we can only get this up and running in 1 in 5 hospitals.
No, Eamon, we didn't say that we were going to deliver 7-day services for the whole NHS by next March. We said we were going to roll it out gradually, and the first step would be to do it in 1 in 5 hospitals by March 2017, April 2017, and we're on track for that, and we will deliver it to all hospitals by the end of the Parliament, and that will be a good thing for patients who use the NHS. But those same patients will be asking this morning why it is that the BMA, who only in May said that this deal we have now is a good deal for doctors, a good deal for patients, it's good for the NHS, it's good for equality, are now saying that it's such a bad deal that they want to inflict the worst doctor strike in NHS history, causing all that misery that you put up on the screen just now. And I think this is the wrong way. If they have concerns about how we're trying to make the NHS safer, then sit around the table and talk to us. And I thought we had that because we did the deal in May.
Well, Health
We've actually had some very constructive meetings since then.
Health Secretary, I just want to say, I know you do say talk to us and you come across a very calm man on screen, but I do have to say, in my time interviewing you over the years, I continually hear that you do not return calls, that you do not have meetings with the junior doctors, and you know what? It's repeated so often, it has to be more than folklore.
Well, I'm sorry, I think you are taking comments of people in the heat of an industrial dispute, but actually I had a meeting with the leaders of the BMA only this week. I've had meetings over the summer. We've had actually a very constructive dialogue until this decision was taken yesterday, and we cannot understand why. When we were making real progress in July, they wrote to us and said there were just 4 outstanding issues of concern, and we've solved 2 of those 4 issues to their satisfaction, and we were in the process of looking at the other 2. That is the way you solve these problems. It's by sitting around the table, building an atmosphere of trust, and that's what we've been trying to do.
There's
and
no
we
doubt.
want, in the end, to do the right thing for patients, which is what this is all about.
What's happened in the past, obviously, is that the leadership and the membership, obviously, are differing. They're at odds. But then we have to look at you, and Theresa May, she said continue as Health Secretary. I'm sure she didn't say let's continue with strikes, let's have a few of those in September. But that you will say you have the solutions. They may say, do you know what, this man Hunt, he's so toxic, he's not part of the solution, he's part of the problem. Would you accept any validity with that?
No. And Eamon, you've interviewed me many times and you've interviewed many health secretaries before me. And you know that Health Secretary is never the most popular job in British politics because people are passionate about the NHS and changes are inevitably controversial. But what actually matters is, are you doing the right thing for patients? And do patients, when they look back on this period, they will say, was the government trying to make our hospitals better and safer? And actually, doctors, even on the other side to me in this dispute, recognise that we need to do better in terms of the consistency of services offered at weekends. And that, we need to make improvements in that area, and they should be sitting around and talking with us about how to do that, not choosing this path of confrontation.
Look, I just want to gauge social media reaction that's coming in as I'm talking to you. Now, up until now, by and large, the doctors have enjoyed public support. That may change depending on how long this goes on. Isabel, what are folks saying?
Mr. Hunt, I just wanted to ask you, because I know you were just saying then, your job doesn't necessarily make you popular. You're certainly the most unpopular health secretary in recent history with medics. I just wonder what you think of the public opinion. I just want to read you a couple of tweets that have come in. Peter Thompson saying, any and every junior doctor who goes on a 5-day strike should be sacked and sued for their education costs. The NHS does not need militants. Christian James saying, the junior doctor strike is silly. I cannot support the devastation. And I wonder if the reason that you're being so resolute is because you think you actually have the support of the general public.
Well, I think it's a difficult question to answer, Isabel, because when the public have a choice between doctors and politicians, they generally choose the doctors. And, along with journalists, if I may say, we're not usually the most loved people in the political spectrum. But I do think what matters here is not actually what people say in the heat of the moment. It's what people say in 3, 4, 5 years' time. Were these decisions necessary and important to make the NHS the pride of the world, which is what we want it to be? But if we want it to be, we can't rest on our laurels, and we have to continually look at things that we need to do better. And one of those is the quality of weekend care, but there are lots of other things in terms of our speed of cancer diagnosis, the way we look after people with dementia, the amount of time people have to wait for a GP appointment. We want to tackle all of those things. Mm-hmm. And I think the only sensible thing in these situations is to press on and do the right thing. And then I think the public will eventually recognise that was the right thing to do.
I always find you a very interesting character, Health Secretary, because you're not a man who's easily...
Thing to say.
No, it's true. It's true. I don't think, if I was sitting across the table negotiating with you, you don't strike me as a man who would lose his temper. You're not a man who's easily riled. You know your own mind. So I put this to you. What do you see is the main sticking point? Just one thing. Give me one thing that is preventing you two having a deal.
Well, the main sticking point, I think we know what it is, because the BMA have told us in writing that the main sticking point are two issues around pay, Saturday pay and automatic pay rises for part-time workers. And, we were willing to have a dialogue on those issues, but the only thing I would say is that weekend pay rates for doctors are higher than for nurses, higher than for police officers, higher than for fire officers. So I actually think in the 7-day society, 24/7 society that we live in, it is a very fair and reasonable deal.
Okay, and are you a fair and reasonable man? Are you a man that you can do a deal with?
Well, I would like to think so. I mean, we did a deal in May. We had exhaustive discussions. I think we made a huge amount of progress, and I would like to continue that spirit of dialogue and trust and turn away from this path of confrontation.
OK, well, I've got to turn away from you now because I've got a doctor in the house, and I know protocol doesn't allow the both of you to talk at this stage. So appreciate your time, Health Secretary, today.